From the School of Mathematics and Statistics at the University of Canterbury, Professor Michael Plank. Mike, thanks for joining us so much, man. Good to have you on board.
Kia ora, Pat. Nice to be here.
Yeah, well, look, big announcement, because I was driving and listening to the Prime Minister at 4 o'clock live. So I was kind of doing this and this. But I think I heard her say that it's the first time in 3 years there's going to be sort of no restrictions at all, really. There are a few, like in healthcare settings, but really almost society can get back to life before the pandemic when it comes to things like masks, mandates, that sort of thing on the most. And I thought this will be really interesting to talk about. I've already seen on Twitter some people kind of going, ooh, and other people going, woohoo. So we first met you, we being me in this thing, talking about modeling. I want to talk to you about modeling for this shortly, but the first thing is just your reaction to the announcement today of not just going to green, but going bye-bye to the traffic light system.
Yeah, look. Overall, I think today's changes are a pretty sensible response to the situation that we're in now. Cases, hospitalizations, and deaths are at the lowest levels we've seen since February. And so the risk level we have in the community is much, much lower than we've seen in recent times at the moment. Now, it may not stay that way forever, and sooner or later we will get another wave of COVID. So we need to keep ready, and we need to be prepared to change things up if the situation warrants it. But on the other hand, I don't think we can sort of necessarily keep measures in place forever. Just because we might need them at some point in the future. So I think it's more about we really should be focusing now on a set of measures that can largely happen in the background, unnoticed by the general population on a day-to-day basis, and that includes things like ventilation, sick pay entitlements, so that people they can afford to stay home if they're sick, as well as continued investment in vaccine development and delivery.
As I was listening to the absolute words, as in she was using absolute phrases of the Prime Minister. She said it's now safe. And I thought, safer? Would safer have been a better word? Because safe, like we talk about the messaging that's come out from the 9th floor, and sometimes I'm a bit concerned that now everyone will go, there's nothing to worry about, because the Prime Minister has used the word, it's now safe. She also said, this will be the first summer in 3 years that nothing will get cancelled and that you can make your summer plans. That's not what you've just said, Michael. You've kind of said there could be some ups and downs, and there could be changes. The way the Prime Minister said it today was like, we are never going back. Do you agree that was her messaging, and how would you respond to that?
I mean, what does safe mean? Nothing is ever 100% safe, including going out of your front door in the morning, right? So, these things aren't black and white. It is always shades of grey. Things are certainly a lot safer now than they have been earlier on in the year,
for sure,
from a COVID point of view. But yeah, we're still in a volatile and difficult to predict situation. We don't know when the next sort of major new variant will come along. Whether we'll get a sort of another Omicron, something that sort of completely comes out of left field and really causes a major wave in that way, or whether we'll settle down into a slightly more predictable pattern where the virus will continue to evolve, but maybe it does it more gradually rather than that sort of big leap that we saw with Omicron. I don't think we know that for certain yet. So, it's certainly hard to give certainties. That's definitely true.
When we met, as I said earlier, we met you, BHN met you in your capacity as a modeller. Has there been any modelling done for this moment? And, like the next 6 months, 12 months, 18 months, what does it tell us if there has been some done?
Yeah, look, we have been doing some modelling around the effect of changes in the transmission rate that might result from things like less mask use in the community. I should caveat it at the start by saying it's really difficult to know what the effect of a change in a specific policy is.
Yeah.
Because I think it's fair to say that mask use has already probably dropped off a bit since maybe earlier in the year when Omicron first came along. And of course, some people will continue to wear masks, and that's great. We should be grateful to anyone wearing a mask because they're doing a small action to reduce the risk for everyone by doing that. So how much of a change we'll see as a result of today's announcements is difficult to predict. What I would say we can see in the modelling is that if you have a change in the transmission as a result of a policy change, that can give you a short-term bump. So maybe we'll see an increase in cases following today's announcement. I'm not sure that will happen, but it's possible. However, the effect on the long-term number of infections is smaller. There's sort of a natural equilibrium in this system now, and changes in the short term can bump you around, and you might get a bump in cases. But in the long term, it's probably going to have a marginal effect going forward on the number of infections that we get. That's not to say it doesn't matter or that we shouldn't bother with it, because of course there are high-risk people and people who are protected by mask wearing that are vulnerable for whatever reason. And so wearing masks is still important to reduce risk for those people.
When it comes to modelling and kind of looking at the how it's flowing through society and the numbers behind it and stuff, I mean, I'm not superstitious, but it's kind of that thing. You don't want to say things out loud in case you affect the outcome, that sort of vibe. But it feels like we've had Omicron for quite a long time and we haven't seen any more variants. What needs to happen for us to kind of go, well, that's our bird flu done, that's our swine flu done, it's now actually all behind us, and it's not, we're either gonna live with this forever, which seems to be the common parlance for the last year or so, but the numbers are dramatically dropping every day. And what would we need to actually see for a bit to be us going, remember 2 years ago when COVID was in the community and it's no longer around?
Yeah, I don't think there's a sort of a sudden day where everyone will agree that the pandemic is over. I think pandemics start with a bang, but they end with a whimper.
Right.
I think gradually it will be a process where the pandemic gradually tapers away over a period of years. I mean, for example, the 1918 flu pandemic was still causing waves of flu for several years, and the impacts of that, went on for quite a long time. So yeah, I don't think there's sort of an agreed definition of when the pandemic ends. I think it will end over a gradual time period as we see a reduction in the health burden, but also the response to it. There was a nice piece I read in The Guardian, I think it was not long ago, that talked of three types of ends to the pandemic. One being the health end, or the medical end to the pandemic. The other one being the social end to the pandemic, which is when do people sort of go back to their normal lives for the most part. And the other one I think was the political end to the pandemic. So there's sort of there's these different aspects to it, and arguably we're perhaps close to the political and the social end of the pandemic, but maybe not quite at the medical end yet.
I'm trying to ask this of a few people through the day since the announcement, and I've said all the way through, I've probably said this to you, Michael, that especially since Omicron's come in, and especially since we moved to orange, I'd like to try and get my information from people like you and from Anna Brooks and from Michael Baker, as opposed to necessarily from the 9th floor. I'm no conspiracy theorist, not saying the 9th floor is out to hurt anyone, but sometimes it seems that some people who are at the pointy end are saying something slightly different from the people, after it goes through what the consensus for the country is. So I was just thinking after the announcement, people like yourself who are in the thick of it, I'm someone who kind of goes to the supermarket most days. I buy little things, and I thought I was at the supermarket today and I wore my mask, and what would I do tomorrow when I don't have to? And I thought, I want to ask you guys that question. So if you were in a place today where you had to wear a mask, like a petrol station or a supermarket or a general place today, what will you be doing tomorrow, actually, you personally?
I should start off by saying I don't often go into shops. We generally get our groceries online or do the click and collect thing.
But somewhere, might attend, whatever it's going to be.
Will I change what I'm doing? I don't. Probably not. Okay. At least to start with, I think. I think I already sort of consider a little bit when should I wear a mask and when don't I, and that I probably won't change anything too drastically straight away. But I think over time, you do reevaluate that a little bit, and perhaps the situations where I wear a mask now are not quite the same as what they were in March. Of this year. So I think a gradual reevaluation of that sort of thing is okay. I mean, it does also depend whether you've had it. We know that the immunity you get from prior infection is not perfect, and it wanes over time. But if you've had COVID relatively recently, and you've cleared your rats are negative, then you're pretty low risk.
Yeah. For BA5. Yeah. No one knows about the next ituration, should there be one?
But, absolutely. Yeah. And of course, what waning immunity is a thing, and if it's if it's several months, 6 months since you've had it, then that risk does start to ramp back up again.
And I guess the flip side to having it is having a booster. I know that the boosters, that fourth booster, is still only for over 50s or healthcare workers. I may have missed it. You may know. Tell us if you have. But what I'll say is I've missed it at the point of us recording this conversation. Maybe by the time we broadcast, I won't have. But I don't know anything, because the other thing is to be updated with your boosters. So I'm under 50. I would do a fourth hit if they offered it to me now, but they're not. So that's the flip side of that. Has there been any conversation that you've heard out there about when that's going to be made more available to under 50s?
I think Minister Verrill said they're expecting an announcement on that this week. So I don't know what that announcement will be, but certainly watch this space, and completely agree. Look, making sure you're up to date with your boosters is the number one thing that anyone can do to protect their own health. But it does also have an effect on transmission as well. And the other thing to keep an eye on is the new updated vaccines that Pfizer and others have rolled out now, or are starting to roll out, that specifically target Omicron. Cool. These aren't available in New Zealand yet, but hopefully, at some point they will be. And these are potentially going to give people better protection to the current crop of variants as well.
I think they'll go all Oprah Winfrey on it, won't they? You get a vaccine, you get a vaccine, everybody gets a vaccine. Because that's surely, if they're opening it up, that's the flip side. They also have to offer the protections if they're going to open it up, or else those who either don't have that natural immunity from a recent case or who aren't up to date will then continue to, that's the other way to put it in the rear vision mirror eventually, whenever that is, I would assume. Not being the layman here, Michael, you can correct me if I'm wrong, but that's how I see it.
Yeah, I mean, I think we'll continue to see vaccines prioritized towards those who are higher risk, which primarily for COVID means older people. It's not to say that younger people shouldn't get vaccinated, but it might start to look something a little bit more like flu, where there's an annual update, or some sort of on a regular cycle, you're offered an updated vaccine, much as we are with annual flu jab.
Very good. Last question. It's just really, one word answer. Are you kind of excited about this announcement today? Do you think choice cool, or are you more like a bit apprehensive, or you think it's the wrong decision?
I wouldn't say excited, but I think it's got the balance about right.